I'm just going to wait for more people to come on. Welcome, welcome, welcome to our live free mini class today on fluid and electrolyte study techniques. Remember, I said that this is not going to be a content review, but it's going to be more or less how to approach the information, the nursing content that you need to pull out. Okay, so I'm just going to wait for more people to join. If you can hear me, type yes in the comments, please. Oh, good. Welcome, welcome, welcome. I got my notes and I'm ready for you guys, okay? Okay, all right, all right. Everybody is joining on. Just going to share this on my business page. Okay, so we're going to go ahead and get started. And all right, so I want to introduce myself because I know we do have some new members in the group that may have not started nursing school yet or are in their first and second semesters. We have all types of members in our group here. So my name is Renee Dyson. I am a bachelor's prepared registered nurse, and I am the founder of New Nurse University, Inc. Okay, it's a tutoring company that is focused on bridging the gap between nursing students who need remediation throughout their nursing program. Okay, so I am your go-to resource. I like to specialize in study habits because I feel like nobody is really teaching you how to study. Okay, and so if you do have questions on how to organize your notes, how to develop your critical thinking skills, and how to use test taking strategies, that's me. That's my area. I kind of have a gift at breaking things down for you guys, for nursing students and graduates and things like that. So without further ado, today we are talking about fluid and electrolyte techniques. And there are 4 techniques that you guys should be aware of. Okay. These are study habits. This is like you know how you have a study guide and there's a formula you should follow. So every time you want to know about, when you want to learn about nursing content, there should be a formula for you to follow, or a template, a guide, something that points you in the right direction. And that's what I'm giving you here today. All right. So if you are ready for me to discuss the first technique, put a 1 in the comments. If you are ready for me to discuss the first technique, put a 1 in the comments, please. That just lets me know that you're here with me, you're paying attention, and you're engaging. Thank you guys for joining in. There's my ones. Okay. So you've probably heard this many times from me or someone else or another resourceful person. But the first things first, when you guys are studying, you have to start thinking like a nurse, okay, right now. It's not enough to just study like it's not enough to just study the words on a page, because if it's not related, if you can't relate it to you, if you can't put an example to it, it's going to go in one ear and out the other. You're not going to remember it tomorrow. Like, you have to study in a way that you're going to remember things tomorrow and in the long run. So the first technique for fluid and electrolytes, first of all, we're going to break it down. Let's break this down. Learn about fluids first, okay? Before you even get to electrolytes, you have to know about fluids. Like, what is fluids? What are they talking about? Okay. Ask yourself. You guys are not asking the right questions in order to think like a nurse. You have to ask yourself, where is the fluid normally located? Okay, the first technique, write this down. The first technique is normal location. Where is the fluid normally located? Where is the fluid normally located? Sorry, I'm typing it in the group comments as the first technique. Okay, you have to ask yourself this, because you will get questions that are very important to normal location and function. And if you don't know it, that's how you get confused. So where is the fluid normally located? Okay, that's what you want to ask yourself. Now let me elaborate, right? So normally, okay, you have these fluid compartments, and this is in your Saunders book. And if you don't want to read it, go to YouTube, find an animated video. I even posted one in under our events tab, okay? Fluid location, you have extracellular compartment, intracellular compartment, okay? Those are your compartments. Now, if you don't understand that fully, Hurst mentions the vascular space a lot. If you have ever taken the Hurst review, or if you have ever heard your teacher say intravascular space or the vascular space, that is the extracellular compartment. And to even take it one step further, it's your circulatory system, period. Taking you back to anatomy and physiology, it's your circulatory system, okay? So what does the vascular space consist of? What does it look like? What's in it, right? Those are the questions you need to be asking yourself. This is normal. We haven't even gotten to abnormal yet. This is normal. So whenever the first technique, when you want to study something, you have to know normal location and function, okay? Normal location and function. So the normal location of the vascular space is the extracellular compartment, right? What does it consist of? It consists of blood, all right? And it's your circulatory system. So your circulatory system is the heart, right? Pumping blood throughout the body so that tissues can get oxygen and your organs can get the nutrients, and the cells can get the nutrients that it needs to stay alive. That's your circulatory system. Okay, it's a closed system, which just means that it doesn't end. Okay, inside the blood. What is inside the blood? Okay, you got blood cells, you got white blood cells, you got red blood cells. Okay, You got platelets. You also have plasma and proteins. That is what consists of the vascular space, intravascular space. You want to think blood, period. Keep it simple, right? You guys have heard this before, but it takes time to put everything together. Okay, so that was the first technique, normal function, normal location. So the normal function is your patho, right? I just gave it to you. Normal function of the vascular space or the circulatory system is the heart pumping the blood throughout the body so that tissues and organs and nutrients and oxygen is all connected together to stay alive. Okay, you've heard that osmosis, diffusion, all of that stuff. That's where that takes place. Okay. Now, abnormal function is the second technique. Okay, you need to identify what is the problem. What's the abnormal function? And a lot of times when we're in nursing school, we skip through the normal function because, many teachers feel like, okay, you've had anatomy and physiology before, you know normal already. So let me just get to, cut to the chase and get to abnormal function. Well, you might need a refresher on the normal function and location. The abnormal function is still your patho. I just gave you normal function. And now we're going to our second technique, which is identifying the abnormal function. And it's nothing that you haven't heard before, right? What is the abnormal function of fluid? We're not on electrolytes yet. What is the normal function of fluid? The abnormal function of fluid. That's what you should be writing down. What is the abnormal function of fluid? Okay, that is your hypovolemia and your hypovolemia and your hypervolemia, right? Hypervolemia is your fluid volume excess, and hypovolemia would be your fluid volume deficit. See, simple. You have heard this many times before. Okay. After identifying the abnormal function, now you need to know why it's happening. What's causing this to function abnormally, right? What's causing things to function abnormally? That's what you should be thinking. Okay, that is definitely what you want to think now while you're not on the floor as a nurse working already. And even when you pass NCLEX, your exams, nursing school, and you get on the floor, you still want to say, hey, what's causing this abnormal function? Okay, that's why it's imperative now that you think like a nurse. That's why it's imperative right now you think like a nurse. And then you go on to learn signs and symptoms. Everybody wants to start learning signs and symptoms first. Well, there's a process. Okay, signs and symptoms, you have to ask yourself, how is this patient going to present to me when you're studying? But in the real world, when you're on the floor, you're going to see the signs and symptoms inside your assessment. Okay, but for the purpose of answering questions, you need to think, how is this patient going to present to me? That's how you're going to retain signs and symptoms. So let's recap before I go on. Okay, let's recap. Number one, the technique was you have to refresh your normal location and function of fluid. Okay, where's the fluid normally located? Inside the vascular space. Now, of course, there are other spaces that holds fluid, but I'm talking about blood. Okay. What does the vascular space consist of? All right, those are the questions you need to be asking yourself. Blood consists of your blood cells, which is the white blood cells, red blood cells, platelets, right? The plasma, The protein, what is the circulatory system? It is the heart pumping. This is normal function. Okay, this is the heart pumping blood throughout the body so that tissues and organs can get the nutrients and oxygen that it's needed to stay alive. That is your circulatory system. Okay, it consists of arteries, capillaries, veins. Okay, that's all normal function. Once you know that, you can move on to abnormal function. Okay, abnormal function and location. That's the second technique. What is causing, what is abnormal function? What does it look like? What does it consist of? That's your hypovolemia and your hypervolemia. Okay, fluid volume excess and fluid volume deficit. That's the problem, right? That's the abnormal function. That's your patho. So now you need to know what causes abnormal function. Somebody put one thing that causes hypovolemia in the comments. Somebody put one cause for abnormal function that would cause hypovolemia. So what causes hypovolemia basically is what I'm trying to say. What causes hypovolemia? Put it in the comments. And then the last recap that I want to say is signs and symptoms. You always try to run and, memorize the signs and symptoms first, but if you don't have any basis for it, if you don't have any causes, then you're not going to be able to retain signs and symptoms. Signs and symptoms is how the patient is going to present to you. So that's how you critically think. How will this patient present to me? If you ask yourself in that way, then you'll be able to remember. Okay, so yes, somebody said something, one cause of hypovolemia, which is fluid volume deficit, is hemorrhage. Absolutely correct. Okay, you have a patient that's hemorrhaging and they're losing blood from the vascular space. That means that the heart has less blood to pump than originally what it started out with. So how is oxygen going to get to the tissues then if the heart doesn't have enough blood to pump, right? Your wheels should be turning right now like, oh my God. Okay, now I see what she's saying. Okay, so you have to know the causes of abnormal function. That's in addition to even knowing what the abnormal function is, okay? And then you go to signs and symptoms. So if you're ready for the third technique, okay? If you're ready for the third technique, put a 3 in the comments. If you're ready for the third technique of how to study fluid and electrolytes, put a 3 in the comments. Now, the fancy way of learning this is on YouTube. They have animated videos and they have people that draw on blackboards or whiteboards or whatever. I don't have a fancy way of showing you. Like, I refuse to draw on a whiteboard. And that's just me. But if you're picking up what I'm putting down, and when you go to view those things on YouTube, it should make more sense. Okay, so I have some 3s. The third thing is, the third technique that you want to pull out from whatever resource you're using is your interventions. As a nurse, you should be asking yourself, what am I going to do about this cause? What am I going to do about this abnormal function? What am I going to do about this sign or symptom that's been presented to me, right? If you know the signs and symptoms of hemorrhage, then you know what your interventions are, right? If I put it in perspective like this, you have a patient that's hemorrhaging. What's the first thing you want to do as a nurse? Something that you can do before you even call the doctor. Type your answer in the comments. If you have a patient that's hemorrhaging, okay, the hemorrhage is the cause of fluid volume deficit. If you have a patient that's hemorrhaging, And what is something that you can do about it before you even call the doctor? Put your answers in the comments. Just to bring this little mini class to life for you guys, because I know you guys are like, I have no idea what she's talking about. So what is the intervention to hemorrhaging? What is the first thing you can do? Nobody? So one of the things that you can do is you can IV bolus. Give the patient an IV bolus of fluid, right? Because that's what's leaving. We got to put it back. So you want to ask yourself, when you are pulling out this information, what am I going to be doing about this problem that I found, right? And then you have to ask yourself, well, which fluid do I use to correct the abnormal function? Okay, which fluid am I going to use to correct the abnormal function? If it's a fluid volume deficit and the patient is hemorrhaging, and we need to open up wide our fluids with a bolus, we have to figure out which fluid we're going to use to correct the situation. That information is also in your Saunders book. Do you see how this is coming along, how your notes should be stacked? Normal function location, right? Normal location, normal function, and then abnormal function, which is still your patho, and then interventions. Your interventions, right? Your interventions. What am I going to do about this as the nurse? You have to do something. You just can't sit there and delay care because you don't know what to do. That's what you should be pulling out, okay? You should expect the doctor to treat the underlying cause in addition to signs and symptoms. That's how you get your interventions, right? And then the doctor's going to order your 500 milliliter bolus of 0.9 normal saline. They're going to tell you, right? It's up to you to understand why you're giving 0.9 normal saline. Or if he or she, the doctor, physician, so in emergency situations, right? In emergency situations, we can give IV boluses to our patients and get the order later. Or you should be expecting the doctor to order a bolus of fluid, right? Just let them know, I gave 500, mLs of IV fluid. And they're going to say, okay, let me put the order in. That's in the real world. But in NCLEX land, you already have an order, okay? In NCLEX land, you already have an order for that IV bolus. They just want you to know that you're supposed to bolus the patient, period. Okay? They don't want you to be worried about whether or not you have an order for it. Like, okay, so that's the difference, I want to say. Okay, so interventions. You need to think like a nurse and ask yourself, what am I going to do about it? And you need to think even further and say, which fluids do I expect the doctor to order, right? It depends on the situation. It depends on what the patient is, how the patient is losing their fluids, right? If it's a burn patient, the burn patient is going to get different fluids from the hemorrhaging patient, or like a postpartum hemorrhage patient. Well, technically no, but you know what I mean. From the dehydrated patient, I should say. Okay, dehydrated patient may get something else with electrolytes in it where, the hemorrhaging patient may just get the 0.9. or the dehydrated patient may just get the 0.9. The burn patient may get the lactated renders. It's up to you to go pull that information out of your Saunders book or whatever resource you're using, your ATI books, right? It's up to you to go pull that information out. But you gotta think about what's going on. Okay, so the last technique that you will be using, okay, to pull information out is evaluations. You need to evaluate the situation and if the cause was treated. All right, you would know by doing your interventions, because if the underlying cause is not treated, them signs and symptoms will never go away, period. Right? So let's take the asthma patient for example. If one of your interventions is to administer a bronchodilator and you don't administer a bronchodilator, the signs and symptoms are still going to be there. Okay? If you administer a steroid instead, or, if you administer maybe a steroid before the bronchodilator, before you even open up the lung, the signs and symptoms are going to stay there. Does that make sense? That in evaluating and reassessing and reevaluating your patient, you need to understand if the cause got treated, if the underlying cause causing the abnormal function got treated. That's what you should be evaluating and pulling out of your resources, okay? Enough to study the fluids, all right? Did the signs and symptoms get resolved? Okay, if you have a patient that's wheezing and you administer your bronchodilator as your intervention, did they stop wheezing? Yes. Okay, goal met. All right, that's equivalent to your care plan. If they haven't stopped wheezing, goal not met. Right, that's your evaluation. You're gonna call the doctor back and say, hey, this patient is not, this patient's still wheezing. Can we do a steroid? I'm just giving this respiratory example just to make it a little bit clearer. But if it was fluid, if it was a fluid situation, then you still have to say, hey, IV fluid ran in at 1,000 milliliters. This patient is still cold and clammy. This patient is still confused. And then the doctor's going to come back and say, okay, give them fresh frozen plasma or packed red blood cells, right? Because it's still a fluid problem that's functioning abnormally. The cause of it has not been resolved with the IV fluids, so we go further and we maybe initiate blood. Does that make sense to you guys? You have to know that a technique for studying would be to see if this doesn't work, then what do I do next? Like, what comes after that? If the IV fluids don't work, then what else are we doing? Why is there an intervention for blood administration when there's a intervention for IV fluid bolus? Like, why are these two things happening, right? So it's a very, very, very important that you use these techniques that I'm teaching you to organize your notes about fluid. We haven't even gotten to electrolytes yet. Okay, so if you guys are ready for electrolytes, put a 1 in the comments for me. If you are ready for electrolytes and what to pull out, put a 1 in the comments. If this is making sense to you, please give me an emoji or something, like a heart or something. If it's making sense to you, I need to know that this is making sense. Otherwise, I'm just going to go over it again. I need to know that this is helping you. You should be writing this down. This is your formula to pull out the information, right? This is your techniques. This is what you should use. So I don't want to hear you guys saying, I don't know where to start. I don't know how to study fluid electrolytes. I just gave you study tips on how to approach fluid and electrolytes, okay? Well, the fluid part. Now we're going to break down the electrolyte part. So, okay. I see my ones. Here we go. Again, we're going back over our techniques. Where are the electrolytes normally located? You have to think about that. Okay, back to your anatomy. Where are these electrolytes normally located, right? Because NCLEX style questions that you study with will definitely ask you or put you in a situation where you would need to know that. Let me give you an example. Potassium is located where? Where? It's two places potassium is located. Please put that in the comments. Potassium is located in two places, normally located in two places. Normally, potassium is located in the body in two places. I would like to know where. Please put your answers in the comments. Inside where? Inside where? Where are this? Yes. Farina says it's inside the cell. So, where else is potassium located? That's the most common answer that you're going to get, inside the cell. But if you don't know about this second location, then you are not going to get that answer correct for that question. It's very important to know where the electrolytes are normally located. Okay, and this is what you should be writing down for electrolytes. So we broke down fluids, now we're breaking down electrolytes. This is the first technique. Where are the electrolytes normally located? So the other most important location is the gut. The gut, right? In the stomach. I think it's the intestines or the stomach. In the gut. That's what that's what's said. In the gut. So, I think it's the stomach. So, quite naturally, okay, you need to know that because your questions are going to expect you to know that, right? You need to pull that information from your questions, your resources, All right, sodium is throughout the body. Sodium is throughout the body. That's why when you have an abnormal function, okay, an abnormal function of sodium, either it's too much or it's too little, right? You get the signs and symptoms that you get. So that was the first technique, which is normal location. All right, now what's normal function? What's normal function of your electrolytes? That's what you should be writing down. That's what you should be pulling out of your resources. What the normal function of each electrolyte is, right? Okay. Sometimes you may have to Google that or use YouTube, animated video, whatever. Okay, you gotta know normal before you can know abnormal. Okay, and now abnormal function. Identify the problem. You can have hyper or hypo, which I just said. Hyper is too much. Too much of an electrolyte in a space where it's not supposed to be, right? Or too little of an electrolyte in a space where it normally is. Okay? So, again, this is still under abnormal function. You still have to know what causes it. What causes these abnormal functions of electrolytes? The hypokalemia, the hyperkalemia, the hyponatremia, the hyponatremia. What causes these things to happen? Okay, what causes these electrolytes to, be excreted too much or be retained and not have enough? what, what causes the sodium to be too much in the body, or what causes the sodium to be too little in the body? Okay, so that's something that you should be pulling out, is the cause. And then you can retain signs and symptoms, right? Then you can retain hallmark signs, which I feel like the hallmark sign makes a sign or symptom stand out different from the rest of everything else. So like, let's take potassium, right? If you have an NG tube in and it's suctioning, it's doing its decompression thing, you're suctioning out all of the potassium from the stomach. So now you're going to have an imbalance of that electrolyte in its normal location. Does that make sense? And now you're going to start to see things like decreased bowel sounds, because if you don't have enough potassium inside the stomach where it normally is, you have decreased GI motility. So on that list, you know, under, what is it, hypokalemia, and it says gastrointestinal, and it says decreased bowel sounds, that's why. One of the causes could be an NG tube, suctioning, excreting out all of the potassium. Does that make sense? You need to know where the normal function is, you know, the normal location is. You need to know the abnormal, and you need to know the cause of it. And then can you understand why those signs and symptoms are happening? If you understand why the signs and symptoms are happening, then you can better remember, retain signs and symptoms. But if you just memorize the signs and symptoms, they mean nothing. They mean nothing to you. It has no meaning as to why, you know, hypokalemia would have a GI problem. Like, if you think about it, that doesn't even relate if it's superficial studying, if you're superficially studying. Okay, so let me just give you an example and run through this, because NCLEX questions, your nursing exams, any exam you get, you need to know what's related to your electrolytes. So oftentimes, level of consciousness is related to your sodium, right? Because if you have a sodium imbalance, hypo or hyper, it causes central nervous system abnormal function. Potassium, okay? GI motility and cardiac arrhythmias or cardiac arrest is related to potassium. Those are some of the hallmark signs and symptoms you will come across over and over and over again in your questions. Calcium produces neuro changes. So you're going to see signs and symptoms like what? Chevestic intrasoles. Okay. And then magnesium is also neuro, which is like your DTRs are going to be increased or decreased. All right. You have muscle weakness, cramps, things like that. So if you can relate those two together, then you will be able to remember your signs and symptoms and those hallmark signs and symptoms that make each electrolyte different. Okay. Sodium is the brain changes, right? Potassium is related to cardiac arrhythmias and our cardiac arrest. So those are the things you're going to see that are going to be most commonly presented to you in the question. Okay, so now that we know, you know, how we're supposed to approach the normal location and the normal function and abnormal function, what about our interventions? Our interventions tell us why all of that stuff I just mentioned, you know, kind of like happens, or why we're doing our interventions. especially if you know the cause, the underlying cause. So what are we going to do about these electrolyte imbalances? You have to know. That's what you need to pull out of your resources. What you as the nurse are going to be doing about the electrolyte imbalances, okay? If you have, like I said before, if you have an NG tube in a patient and your labs come back and you have, potassium of 2.5, what are you going to do? What do you expect the doctor to do? Right? That's what you should be pulling from your resources. No more excuses. This technique should help you identify what you pull from your resources and help you create organized notes. Even when your PowerPoints in nursing school are limited and don't give you all the information, okay? So somebody type in the comments, if you had a patient on an NG tube and it's doing its decompression thing, but your labs come back and you have a potassium of 2.5, what are you going to do? What are you going to expect the doctor to do? Keep it simple. Type your answers in the comments. Even before we get to medication, even before we get to medication, even before we shut it off. Shut off the NG tube, right? Shut it off. It's done its job. Let the gut recover. Now we're going to do our replacement medication thing with a potassium supplement, right? Hope that's making sense to you, okay? And knowing your interventions and what you're going to do about it as a nurse is very important. And knowing what the doctor, knowing what to expect the doctor to order is very important. That's how you have to look at this when you're studying. Not just, oh my God, it's so much information. How am I going to remember? This is how you retain. This is how you remember. You ask yourself these questions. What am I going to do about it? What do I think the doctor's going to order? And then write it down or pull it out from your resources. And the last technique, again, is evaluation. Did the underlying cause get treated? We shut off the NG tube. Is the patient going to be losing more potassium? No, not at all. So did the signs and symptoms resolve? Yes. No more leg weakness, right? No more muscle weakness from the patient having too little potassium. Now we're going to give this potassium supplement and the signs and symptoms are going to disappear. Okay? So I'm not going to keep you. If this made sense to you, please let me know. This is just, this is how I like to teach you how to approach nursing content, nursing clinical concepts, okay? If you enjoyed this, then I have a full class that's a paid version that's coming out. So keep on a lookout for that, all right? If you enjoyed me speaking about how to approach, your fluid and electrolytes, then you will be totally shocked at how I break down basically the rest of fluid and electrolyte content, And this formula is pretty much these techniques, this formula that I just given you, the 1, 2, 3, 4 normal, abnormal interventions and evaluations, that's pretty much how you should organize your notes. It should drive your study sessions. Okay, it should really drive your study sessions. So I don't want to hear no more, I don't know how to study fluid and electrolytes. Okay. So thank you guys for tuning in. I will post a link to the full paid course when it's available, of fluid and electrolytes. If you really want me to go in depth and you really want me to help you pull out where the function, where the normal location is for each electrolyte, for each fluid, where it is normally in the body. That's what the paid class is going to teach you. So thank you for tuning in. I hope you enjoyed this. I hope it made sense. Stay tuned for tomorrow. We have another live as well about Saunders. So you guys have a good night.